This is Nurses' Voices.
On today's episode of Nurses' Voices, we'll be speaking with two early career community health nurses from Calgary. I've heard their stories. They are amazing. You'll want to tune in.
Nurses' Voices is supported by the Canadian Nurses Foundation and by the Canadian Nurses Association.
I'm really pleased to introduce two nurses. First, Tegan Broadhurst, who's a licensed practical nurse. Through her roles working in both acute care and community and addictions nursing, Tegan told me that she's found her passion in helping create better outcomes for vulnerable populations, both while in hospital and the community. So welcome to Tegan. And we have Alysha Samji. Alysha is a registered nurse and a new grad. She just graduated last year. She has already a full-time charge position, and she works alongside vulnerable populations that face addiction, mental health, and homelessness. Alysha told me she's found immense fulfillment in working in the community and plans to further her career and her education in this field. I'm wondering if we could start with you, Tegan, and if you could just tell us and the listener about the assisted self-isolation site.
It was kind of like a pop-up project. We saw the need for isolating people who typically stay in shelters, and we needed a better option just to reduce that spread of COVID within that population. So the Alex, working with AHS and working with the government, has leased a hotel for people from those populations to isolate with us. So we provide like nursing and social care while they're with us isolating.
What is your role?
Monitoring if people are not doing well with their COVID symptoms, intervening if we need to, and making that call if they need to be hospitalized or what kind of care they need with COVID, but also recognizing the need for support in withdrawal management. People from that population often need some support there if they're not able to be using. And if they do decide to keep using, we can kind of support that too if we need. We just understand the reality of harm reduction.
How many clients do you have there then?
I think the most we've had is around 65 to 70 clients. Yeah, that's when it was probably the busiest. Yeah, and it'll go from maybe 4 clients, and then all of a sudden we'll surge and we'll get 50 intakes in a day.
So I'd be curious to know, Alysha, you're 1 year out of graduation. What drew you to this?
So I actually did my final focus in public health. I was doing vaccinations at a well-child clinic. So throughout nursing school, I was able to experience kind of both acute care as well as community. And community nursing was what really got me feeling passionate, and I felt super, fulfilled with what I was doing over there as opposed to the acute side of things. And I found that it was less skill set focused and more holistic approach to care. So you actually get to know these clients and see what you can do and work with multiple teams and, work socially as well as medically. And so I found a posting for the Alex with ASIS a month after I wrote my RN exam. And so I applied over there. I had no idea what I was getting myself into. They started their program up in April, and I started in May. And so when I started over there, we were kind of getting all our bearings together, figuring out medication delivery, how do we get clients intake, the whole process of things. And so just being there from day one and watching how much our program has evolved has been amazing.
What can you talk a little more about what a day would be like, or a shift? I won't say a day, maybe night, whatever. Because it strikes me, if anything, this is what we mean when we talk about social determinants of health. But by the same token, I'd like to have a better idea of what a day is like, because I would imagine there's a lot of unpredictability.
Mm-hmm. Yeah, I mean, I could probably let Tegan speak more about the days. I've been working full-time nights there. It's been a while that I've been at ASIS during the day. Nights can be pretty crazy too, though. It just kind of depends, like you said, based on the social determinants of health, right? And unfortunately, a lot of these individuals are not able to access a lot of these things that we have, including just the basics, right? Like just adverse childhood events and things like that they've gone through, and the physical environments that they have to survive in. It's really difficult for them. And so, yeah, there's a lot of things that we have to consider. And on nights, we don't really have our social team leads present, and we don't have our physicians present either, which makes things a little bit more difficult. So we do have a really great team where we're able to work cohesively and pass off onto shift report and make sure that our clients are safe at all times, and that we're doing our best to make sure that, you know, they're happy and feel comfortable with us.
Day shift is a lot of like, first thing in the morning, we're handing out medications, whether it be withdrawal management medications or what these clients are on in the community, and we're optimizing their knowledge, allow them to ask questions about why they're on their medications. If people need housing while they're there, we've been lucky enough to be able to start that conversation, have their like housing assessments done. That's like a huge part of it, is socially, what can we do while we have you here?
Right.
You wouldn't be able to access this social support while you're sleeping rough, is like sleeping on the streets, or if you're at our shelters in Calgary, you might not be able to access these social programs. But while we have you here, what can we do to like better your opportunities and your outcomes?
I'm just listening and thinking, whoa, that's a huge challenge and not something you get a lot of experience with in nursing school. Can you talk a little bit about what that was like?
Coming into this, I honestly had no idea about. I kind of, you know, come straight out of nursing school where it felt kind of sheltered. You always had someone around you. To come into this by myself, first of all, I was super scared. And then to take on charge only a couple weeks after that was also quite a challenge for me. I feel like I've grown a lot in my nursing practice, taking courses and taking the initiative to learn about this population, learn about the concept of harm reduction, of trauma-informed care, of how can we better support these individuals as they're so stigmatized out in the community, and not really looked at as a population that matters. And it's heartbreaking. And the more you learn about it, the more you feel so honored and humbled to be able to help these individuals. And, you know, they deserve the same amount of care that anybody else out there does. And so we are super supported by our medical team lead. Ashley's great. We've also got social team leads. You know, we've got physicians as well. And so it's a very, like a very supportive environment. There's lots of communication between teams on and off shift reports as well. And things like that has made our program evolve, grow, and strengthen in a lot of ways.
And what about you, Tegan?
I come from like mostly acute care. This whole world completely new to me. Like I never had a clinical placement in community, but I wanted to be involved, and they encourage you to take some trauma-informed care courses. And it's just kind of opened my eyes to like how much stigma there is in medical care, and people from these populations don't access medical assistance because of that stigma. So that's what I've become really passionate about. ASIS specifically, the nurses and social team that we deal with every day, they're just such a wealth of knowledge, and they're so supportive. And because this was kind of like a pop-up site, we have nurses from all different backgrounds, like acute care, community, addictions, mental health, and everybody just like teach and support each other. And that's been really, really amazing to see and be a part of.
What do you tell your former classmates and colleagues who are still working in what I'll call the more common or more traditional roles in organizations, in rule-bound, very different environments than the ones you're in?
There is like huge differences between acute care nursing and community nursing. And it's just made me realize how much there is to learn just to benefit this population. There's just so much to learn that I didn't know when I was working in acute care. Right. So I'm just trying to bring that to light, and that whole trauma-informed care lens. As an acute care nurse, I didn't understand the amount of stigma. So I'm just trying to like voice that. And there's a reason why even at the hotel, like at ASIS, people don't want to go to hospital. And it's made me realize how much work there is to be done. So I kind of loving being able to go to work and kind of advocate for this population while they're in the hospital. And I feel like the more we talk about it and the more education there is, the better outcome will be for this population.
So you've sort of got a foot in both sectors, but boy, the opportunity, Tegan, for you to be also teaching, it's very organic. You know, you're moving from one sector to the other, but also that ability to share knowledge and to share experiences and sort of to bridge, even when you were talking about many of your clients don't want to go to hospital.
And that like duality of seeing both sides,
yes,
and trying to figure out how we can even it out. Yeah, encourage this population to feel safe while they're in the hospital. I feel like I was just pulled to being able to advocate for people who don't necessarily advocate for themselves all the time.
In a lot of work that Gail and I have done in career, we don't talk a lot about people moving from different sectors. They stay in one, and it's sort of, I get identified in that way. And what you're describing is that possibility to be much more fluidity in movement.
One of the things that's always struck me is somehow, and I think even in my own career, you come to work or a place or a group of people or whatever it is, and even though you might not know a lot about what I'll call the technical parts of it, you don't really know a lot about the work. It feels like the right place. And that's a bit like what I hear you saying. I mean, I didn't know anything about this. I didn't have this experience in nursing school. But then I came there, and I hear you saying it fits for me, and I have something to contribute, and I have something to teach other nurses. I hear that quite a bit, and I hear both of you talking a lot about stigma. Can you say more about that, Alysha?
Yeah, so it's more just the non-considering these people as people. They're not looked at as human beings. They're not looked at as, people that deserve the same like treatment that we do healthcare wise and just in general. And it really stood out to us just, being able to go into these rooms and have these conversations and say, tell me about yourself and what can I do? And, just hearing that, it can take such a long time to build rapport with some of these clients too, because they can't trust you because their entire lives, right? And it's not just from people out there like us that they've never met, but it could be within their own like cohorts or families or whatever it is that they've developed so much mistrust and trauma throughout their lives that they kind of grow this wall and they put it up in front of them. And so people kind of look at them as, oh, it's just someone that's homeless. It doesn't matter, right? And a lot of people do that because they don't have the knowledge. They don't, they've never really interacted with these guys and known that, hey, let's take a second and actually have a conversation and ask, what do you need, right? Like, how can I help you? Even if it's something as simple as giving someone a sandwich out there, right? It's things like that you can do that it's the little things for them that matter. And I think that's so unfortunate that it's not looked at as more of a priority. And even like Tegan said, that they're super scared to go into the hospital a lot of the time because it's kind of that mistreatment that we see too, where the discharge summaries that are, came in, we gave them withdrawal management and kicked them out, doesn't matter, moving on to the next. But, you don't consider that these withdrawals can cause seizures. It also is a life and death situation, is something some other healthcare needs would be too, right? And so that stigma can affect the healthcare of these individuals as well, and just their lives in general. And it's unfortunate to learn that, but it's been such a great opportunity to actually learn more about it and have a part in decreasing that stigma in our own way.
Yeah, I think there's in a way, it's a privilege when you can care for and about people that somehow seem to have been left behind by mainstream society. It's an extra privilege. I mean, it's a privilege to care for people anyway as a nurse, but it's an extra privilege when it's populations that have been somehow left behind or not cared about. Even if they're cared for from time to time, they're not much cared about. So it's pretty impressive to me that two relatively young women have
Yes.
taken up the cause. And I applaud you for that. Good for you. What would you tell schools of nursing?
Yeah.
Since I don't think we do, I mean, I've spent most of my life as an educator. I don't think we do much about this.
Yeah, I mean, when I did my mental health rotation, we did a lot of inpatient and talked more about things like mental health diagnoses, so bipolar, schizophrenia, things like that. And we kind of just skimmed the surface on addiction, but didn't actually go into it and talk about what is withdrawal and how do we manage withdrawal, and kind of touch on these populations that are more prone to using and things like that, and how can we actually support, and what the topic of harm reduction even is. I had no idea what it was prior to starting at ASIS too, right? So I think even though we come from a recovery-based model at ASIS, we do also support clients and meet them where they're at. And I think that's something in nursing school that should be touched on more, is just the topic of trauma-informed care. How can we help you? What does addiction mean? It's got a different definition to everybody, right? And not only the medical treatments, but also what are therapeutic ways that we can also engage and treat these individuals with kind of nonviolent crisis intervention, and just being able to hold a conversation and build that rapport. I think that's something that I wish I had learned a lot more about in nursing school, for sure.
I feel like the biggest points in working with this population is kind of lose your judgment, because I feel like because of that stigma, they're kind of looked down on. But people with addictions or mental health are just trying to cope, just like everybody else. We've all endured trauma in our lives. Some people have better, more productive coping mechanisms. Some people had substance use, and that's, how they had to deal in that time. And that doesn't speak to who they are, like, as a person, or like any moral shortcoming. Like, they're just trying to get by just like everybody else, not looking at anybody with judgment, and just having some compassion for their story, and having that like trauma-informed care. We don't know these people's stories. We could not imagine the trauma that they have been through. We don't need to add to that, making them feel stigmatized when they're trying to reach out. Have some compassion for these people who people have kind of forgotten about.
Seems like good lessons, period, for nursing generally, not just for vulnerable populations, but just part of compassion and caring, I would say, and part of the expertise that people need.
So I'd be curious then. So this site is a pop-up. It came to be because of COVID, but what you're both describing, what I'm hearing, is a different way of caring for individuals, that people can come on site, have an amazing team of health professionals who are listening to these individuals' stories, who are looking at ways of helping them. When COVID is over, has there been conversation about a model like this that isn't a pop-up, is the way we need to care for the vulnerable? Or what does it mean for you in your careers? This is where you say you want to practice.
There is hope that we can maybe change the format, but nothing, we don't know anything yet. But if we could change, formats to, or if the Alex could have opportunities for transitional housing and maintaining this safe space where people can come out and have social and medical support. We all hope that, but right now it's kind of, we're just waiting in limbo.
It would break my heart if this didn't go on. So I really hope that it does. Like Tegan said, it's kind of up in the air right now, but we've definitely had conversations with our teams, and fingers crossed going forward that this will continue on. And, if we got to change our model so that it's not based off COVID, but kind of based on transitional housing and providing support, that would be phenomenal. Being able to advocate and things like that as well. For me, I think I do want to stay in this field, working with this population and addictions. And so I was recently hired on at IOTS in Calgary at the Schumer. So that's the injectable opioid agonistic therapy program.
Oh, okay.
That I also learned through ASIS, because we've got clients coming to us from various places as well. And so clients that came to us from over there, I learned about this program in. And so kind of trying to take my career in that way and expand my knowledge in this kind of field of addictions. Yeah.
What do you see yourself doing down the road?
I would like to continue this path that I've kind of found myself on, and if I could find like an educational role with like harm reduction
Yes.
and trauma-informed care, if I can continue being able to learn and teach that, I feel like that would be where I fit and where I feel best in my nursing practice. I feel like that's where my calling is right now.
I don't know where the time went in the last half hour. I'm sure Gail, so privileged to hear your stories, and I think so important for nurses. Remember how we talked about this is for nurses across Canada to hear what other nurses are doing. And so what you're doing is something right in the thick of COVID, really helping vulnerable people. And I have been so impressed with both your stories. I don't know if there's any last, when you've got the ears of nurses across Canada, is there any last thing you'd say, I don't want to leave this conversation without saying, either of you?
I think just advocate, look out for your clients. Don't be judgmental. You never know what's going on in someone's life. There's always unspoken stories, and just take the time to really get to know your clients and know that you are their support system and you are their strength at the end of the day. And we got to take advantage of that and do what we can for them.
If you don't know about something, if you have questions about harm reduction or community nursing, it's okay, and to ask questions and expand on your knowledge. There's no shame in not knowing. Just continue to learn, and I feel like it's gonna have better outcomes.
That was a really interesting conversation, and those two women were exceptional young nurses. What I found intriguing was that they had very little knowledge about this place to go and work, and they had the courage. They found it interesting, and they just said, what I heard is, I'm just going to try it, and I'm going to learn along the way. And so that was my first aha there, that so many people take so much time, often we know in our experience in careers in nurses, to find that right spot. But there was spontaneity, and they seem to have found their spot in nursing.
Yeah, it was pretty remarkable, that piece of it, because in their nursing education, they didn't learn very much about that. And then they took a chance. And it's fascinating. I think, though, what I have to say that I couldn't stop remembering myself. I don't want to say how many years ago, because I always wanted to do mental health. I had no idea what it is, but I thought I wanted to do it. I had a horrific experience in nursing school. It was really before all the advanced medication and everything. People were still, being tied up and, having cold baths and all of that. And then when we moved to Philadelphia, I got a job in a very progressive mental health setting. Yeah. And I walked in, I knew nothing. And I had a diploma, and it was in the US. Everybody had degrees. People had graduate degrees. I didn't even know there was such a thing. And I just walked in, and 2 weeks later, I knew that was the place for me.
Wow.
And, I have to say I was stupid. I had no idea. But I was probably like these young women, like a sponge.
Yes.
And that was the other thing that struck me. They realized how important support from the team was.
Exactly.
They were quite happy to say, I didn't know. I had to learn. I still have more to learn. And I thought, that's amazing. Every nurse should feel that way when we get started. So I just was having a deja vu experience, just remembering my own early days. But I was very impressed with their compassion.
Mm-hmm.
And I thought they would have something to teach other nurses, because we've become quite technicalized.
Yeah.
There are ways of doing and, technology to help, and whether it's medication or whatever it is, and certain right ways of doing and not right ways of doing. And they seem quite learning how not to judge.
Mm-hmm.
I think we could all learn from that, but I think they would have something to teach nurses about how not to judge. And maybe in these days of recognition of Black Lives Matter, of other movements recognizing diversity, I don't know. I was quite impressed with what they could teach us.
I thought the other thing that was something to explore more is Tegan's comment that she works in acute care and she works at this pop-up, and that ability to move from two very different areas, and what she's learning and able to take what she's learning and help teach others. And also, and so acute care, but also her client group in this assisted self-isolation site, fear hospital. So that there's something there, that tease or that bridging to helping. So you're not just working in one sector or the other sector, that ability to bridge for people, that maybe the ability to help someone who does need to go into the hospital, to be able to have that experience. I don't know what you thought about her comments. I just, yeah.
I think she could probably help the nurses in acute care, help clients who have to go to acute care feel more comfortable.
Yes.
But I think she also, because she would have a comfort level in acute care, could reassure clients in a particular knowing way that might help. It's There was lots in there. I mean, about stigma, about inclusion, about the other. And it's amazing to me that really relatively new, younger graduates can see a path for themselves. And it's impressive.
And I think the last point for me, and it has come up in some of our other Nurses' Voices episodes, was opportunities maybe in the educational system that we haven't tapped or haven't explored. So again, when Tegan talked about, I would really like to further my education so I can take on teaching. I'm not sure what she was thinking about teaching, but again, it's people with experience in a setting who are able to bridge for students in nursing programs what is really going on in some of these areas that maybe aren't the traditional ways that we look about nursing. And that's what I'm hoping Nurses' Voices also is, a platform to help nurses hear different roles of nurses across Canada.
Well, we're probably going to learn where we've got it right in education and where we have room to grow. I'm sure that's going to come up.
Yeah,
because the world is changing, and I think newer graduates are coming. They want to be part of the change.
Yes. Yeah.
And that's what differently.
Yeah, and that's what we heard there with those two women. They want to be part of making. I mean, I just put that out there. Is there a possibility for this, being sustained? Well, we're talking about it, so there's that movement. So that was a great interview.
Agreed.
We'd love to hear from you. We'd love to hear what you thought about today's episode. And if you've got a story to tell, send it to us. Check us out at nursesvoices.ca.
Nurses' Voices is created by Donner Wheeler. It is supported by the Canadian Nurses Foundation and the Canadian Nurses Association. Nurses' Voices is produced by Sector Limited.